Yes, I have met an opioid overdose patient. The scenario was that
He has very stuttered speech and he's not breathing normally.
talking very nonsensically. We couldn't understand what she was saying.
There are students who participated in Emory Emergency Medical Services, and we heard most of them have met overdose patients more than once. Opioid overdose is a worsening epidemic. In the US, opioid overdose deaths rose from 21,089 in 2010 to 50,891 in 2021. According to the CDC, in 2021, 66.8% of drug overdose deaths had at least one potential opportunity for intervention. There are too many potential triggers that we may not prevent in advance. Signs and symptoms of opioid overdose include slow breathing rate, slow heart rate, low blood oxygen level, and low body temperature. This may lead to a loss of consciousness, brain damage, and death. Luckily, naloxone as a morphine receptor antagonist relieves opioid overdose symptoms if injected or sprayed timely. In this paper, strong statistics proved the necessity and importance of early detection. However, most patients are not able to inject naloxone by themselves when they notice or may not realize they are having an overdose. Let's hear some real experiences in reality.
It would be very difficult because they are not in the right state of mind. We call it like altered mental status, and they are unable to recognize who they are, where they are, when it is, spray the right amount in each nostril, making sure you like attach the nostril part correctly to the medication. It is something that someone going through an overdose would likely not get right, and they wouldn't be able to administer it to themselves in a way that would actually have the medication work.
This report shows the emergency of comfortable, systematic wearable devices for preventing overdose deaths. However, only a few technologies may help overdose patients and have defects. Researchers in Purdue University designed an automatic naloxone injection device, which is partially under the skin. Once the device detects low breathing rate, it triggers naloxone release. Automatic naloxone injection is effective, but only breathing rate testing cannot guarantee accurate overdose detection because clinically, patients have various symptoms. In this paper, we see the real need of patients. Researchers said that 70% of survey participants reported a willingness to use a device capable of detecting an overdose and automatically administering a reversal agent upon initial survey. Based on the needs of current market, we'll design a systematic wearable for people who potentially have opioid overdose, a non-invasive option from detection to action. For detection, we measure 4 vital signs. Because of time limit, more details of technology of sensors will be explained in final presentation. A microcontroller makes the sensors operate together. When 2 out of 4 values reach dangerous thresholds and persist for more than 90 seconds, the device will send out a signal to the injection needle placed on the patient's arm. Specifically, breath rate less than 12 BPM, heart rate less than 60 BPM, less than 95% blood oxygen level, and less than 95 Fahrenheit body temperature. Subsequently, 0.5 milligram of naloxone will be injected to the patient's muscle, or alternative mask drug spray option. Meanwhile, 911 is called. For action, we provide 2 options: patch-like wearable needle on arm and mask drug spray. For needle, we were inspired by insulovagal pump design and advanced by the auto injection function. The needle will be activated once our wearable detection device sends out the signal. We also will sustain the manual click-on needle release option.
Naloxone nasal spray can be purchased in a pharmacy without a prescription. The suggested amount for each spray is only 0.1 milliliters. And what if we switch out the filter and the mask with a nasal spray bottle? When we are done with each bottle, we can slide in another one, just like how you slide a GoPro in your helmet. The shape for the bottle can be flexible, and we just need to arrange the bracket shape. Since the amount for the medicine is very small, every part can be light. The bracket can be manufactured to be plastic using injection molding, and they can be either taped or clamped on the mask like the filters.
At the heart of a mask is a unique drug spray bottle, which can lead to a bacterial growth and decrease its medication's efficiency. By separating the medication container from the spray bottle module, our design ensures that the residual medication is minimized and the medication's effectiveness is maximized. Furthermore, it has other advantages mentioned in the slide, such as being a convenient, non-invasive, and low-cost option for patients. And that's all for our presentation. Thank you for listening.